Sarah Smith, S-A-R-A-H, Smith is S-M-I-T-H. I'm a volunteer with Family Alliance of Mental Health Recovery, headquartered in New York, and I am a volunteer with MindFreedom International, headquartered in Eugene, Oregon.
Why is it important for you to do this work?
Because I don't want the same harm that my daughter was subjected to other young people.
So tell me a little bit about that.
My daughter was civilly committed for 12 consecutive terms. As you know, in Oregon, a civil commitment consists of 180 days. And during that time, the state virtually has complete control of your life, where you live, the kind of treatment you receive. They can force you to subject yourself to powerful injections of antipsychotic drugs. They can electroshock you. They can put you in an institution, subject you to restraint, seclusion, solitary confinement, all of the above.
Why is it that, like, can you go into any more detail with what happened with your daughter? Why was that harmful to her?
Yeah, my daughter had a spiritual emergency about 12, 13 years ago that was complicated by childhood trauma and by recreational drug use. Unfortunately, young people having what's known as a first episode of psychosis. In Oregon, there's only a one-size-fits-all treatment modality, and that is like powerful antipsychotics. People aren't given an array of choices, even though there's a really rich spectrum of alternatives out there for helping and providing support to individuals and families where, psychosis happens. They're, instead of being a buffet of options, people are subjected to like a drug-based approach, and in many times by force.
With this bill, what is the element of it that you are in opposition to?
Well, choice in mental health is a human right. People deserve support and they deserve care in a crisis, but they don't deserve to have their civil rights and their civil liberties taken away. They deserve choice, they deserve autonomy, they deserve dignity, and they deserve real help, not control.
So, I'm going to give you some counter examples that people are giving here, because this bill, it has an incredible amount of support and opposition from people really in the same boat. So it's interesting to hear, because there's a lot of, parents with children with mental health issues that are supporting the bill. And there's a lot of mental health organizations that are supporting the bill, and then a lot that are in opposition. So it's kind of an interesting situation here, right? You have a lot of parents or advocates saying there's situations where people with a schizophrenic diagnosis are committing crimes that then are having them locked up for the rest of their life because they're off their medication and nobody can force them to take that medication.
The medication you're referring to is a chemical restraint that can help ease a person in a crisis, but people are being put on these neuroleptics for long term, and that's when the real problems result. I hear other parents concerned about violence. Violence is a concern for everyone, and everyone deserves safety and deserves to be free of violence. So it pains me to think that we are passing a bill that would condone violence in order to combat violence in our society.
Yeah, I understand that perspective. I'm also just curious what your perspective is on the aspect of this where people who do have mental health illnesses are getting, locked up long term, potentially for the rest of their life, because in an act of responding to auditory hallucinations, they are, committing a murder or killing someone. And this has happened multiple times in Oregon where they are found guilty, except for insanity. And the parent even of that child, or the parent of the person who was killed, is saying, hey, if we would have only been able to force them to take that medication, this could have been avoided.
I would say that violence is a problem, and that creating a broad solution that is going to apply to all people who have disturbing behaviors, regardless if they are violent or not. The law will be applied very broadly to a lot of people, not just to those who are at risk of being violent. You have to be very careful when you make laws, because the laws will be applied and abused. The law is very open to being abused. And I believe the law was abused in my daughter's situation. And this will make it more likely that people in my daughter's situation who are not violent will still be subject to state-sanctioned violence.
Tell me a little bit more about
I
that.
think there's other solutions.
I'm sorry, you cut out. I didn't mean to interrupt you. It froze, so I thought you were done with your thought. I apologize. Please continue.
You had a question about my daughter?
Yeah, you were saying there's other solutions. I don't want to interrupt your thought if you wanted to continue on that, but yeah, I do have a question when you're done.
Well, I think when the violence that family members are most concerned about is, what do you do with an adult child when other family members are afraid for their safety? There are a lot of de-escalation techniques that parents can be trained in. In fact, even personnel at ER, at emergency rooms, should be more trained in de-escalation techniques. There's many ways of talking a person down from a very heightened state of, I guess, like a state of consciousness in which they're completely oblivious to reality. There are ways that people can de-escalate disturbing behavior, and I've seen it at work. I've used some of those techniques to our family's benefit, and it requires training and experience. One of the most important things is for family members to learn how to deal with fear. Fear can escalate really tense situations really rapidly. So I would say train the family members and give them the support to deal with crisis. And that having been said, I would say that the things we as a family used to consider to be a crisis now seem like trifles in comparison, because we've evolved as a family in how to handle in a much more productive manner our daughter's altered states of consciousness.
What about folks who don't have family that are able to do that?
That's a really great question. I would still say again that individuals in crisis deserve support, not control. And if they can't find support in their families, I think we as a society need to learn greater tolerance and respect for human dignity. And I think as a society, we need to learn to be a kinder, more gentle society. Not
Going back,
judgmental. Yeah.
Going back to the question about your daughter, tell me a little bit about the changes that you saw from her when she was civilly committed. Why was this impactful to you? What did you see? What did you observe? And then how would you have preferred that to be handled?
I would prefer that she had received all of her mental health treatment voluntarily rather than by force. It eroded her trust in medical providers, and it eroded our family's trust in medical providers. To this day, we are traumatized by her past psychiatric treatment. We don't feel we can fully disclose information safely to medical care providers out of fear that they will distort what we tell them or overreact. And rather than give us support to deal with this in a manner that is in alignment with recovery principles, we're given messages of hopelessness. And I'll give you an example of a message of hopelessness. The fact that schizophrenia is framed as a brain disease that is chronic and it can never have any remission or cure, or it will dog you for life and you have to take medications for life. This is completely false and is not substantiated by the data. Also, the fact that you have to remain on psychiatric drugs for life in order to quote unquote cure or manage your schizophrenia. This is also a false concept. And I don't think society is ready to hear this, but the data does not support this.
What changes did you like? What were the negative changes that you noticed based on the
besides the lack of trust, the fear of disclosing like side effects of medications, for instance, because if you disclose a side effect to psychiatrists, often the result is for the psychiatrist to simply increase the dosage rather than discontinue from the medication or try another one. Also, the rapidity in which many psychiatrists will rapidly take a person off one medication and put them on another without any safe tapering protocols. There's very little research onto how to safely taper, discontinue people from psychiatric medications. The American pharmaceutical industry doesn't seem to have any interest in even researching it. So anecdotally, to safely discontinue from a psychiatric drug or switch to another one, you have to go to the internet and find peer support in order to find protocols on how to do that safely, because you're not likely to find that information from your psychiatrist.
How's your daughter doing now?
Remarkably well, considering the trauma that she's been subjected to. She still doesn't hold a job, but she has problem making and retaining friendships. But we as a family have done a really remarkable job of regaining one another's trust, our ability to communicate. We've been very privileged to be, the fact that she's living at home is a privilege. She's been living at home peacefully for 7 years now. So now she's been living peacefully at home for longer than the time that she was institutionalized, because she was institutionalized for 6 years. And becoming uninstitutionalized is quite, it's a job for someone to be institutionalized and always rely on external accountability rather than internal accountability, being told when you can get up, when you can eat, what you can eat, asking permission for every little thing. It's a process getting someone to be autonomous again. So she's not quite there yet, but she's doing remarkable. She's nonviolent, she's loving, she's kind, she's creative, she's funny. She's just an asset and a joy to be around. So we're very privileged as a family. As for her reintegration back into society, that is going to take a much longer. But you know, what I'd like to say is that the message of hopelessness that she was given about her quote unquote chronic disease, I think we as individuals and families, we need to start really telling our young people greater messages of hope. And a part of that message in hope is eradicating systemic injustice, discrimination. Telling someone they have a chronic disease, by the way, is actually increasing stigma, not decreasing it. And that study after study has confirmed that.
What do you say to people who, I mean, this happens all too often in Oregon, where people are getting locked up for life or multiple stints in the Oregon State Hospital after committing a crime that, you know, has maybe even hurt somebody else or traumatized somebody else or killed somebody else. And how do you fix that without pushing for, you know, commitment?
I think the way you fix that is you involve first of all, you inform the mental health system with the voices and experiences of people who have been on the receiving end of mental health services. Right now, our mental health system is not informed by people with lived experience. We create tokenism. We create opportunities for a few select individuals with experience with the mental health system to have an input or have say, but not nearly to the extent that is required from taking Oregon's mental health system from a completely dysfunctional, expensive, and ineffective, inhumane system to one that is recovery-oriented, hopeful, effective, and humane. To take it from the extreme where it is now, broken, completely ineffective, to one that is effective and humane, requires constantly and being vigilantly mindful. Are we being informed by people with lived experience? Right now, our mental health system, the Oregon Health Authority, and all of the other influential lawmakers and policymakers in Oregon's mental health system are not informed by people with lived experience. And this was on display at the House Judiciary Committee. We had people lined up, people with lived experience in the mental health system. They were lined up to oppose this bill, and they didn't get to speak. They patiently waited in a queue. They waited for our turn, but the time was disproportionately allotted to family members and clinicians and administrators in the mental health system. We've seen this before over and over again. Peer voices, people with lived experience, need to be in leadership roles, designing systems that work to support people, not systems that harm people, not systems that make people chronically dependent on services.
Let me ask you this. In this most recent case where you probably heard about it. I mean, we just covered it this week. I don't know if you have, but the person who was just sent to the Oregon State Hospital and the killing of the mental health worker at a group home in Portland. Did you hear about this case? There was a mental health worker killed at a group home. Granted, like the unions have said, this is because she was working alone. There needed to be better protections for the mental health worker. But there's also people saying, I mean, that the person who was found guilty, except for insanity, had a history of schizophrenia. He had stabbed somebody else, had done a stint in the Oregon State Hospital after being found guilty, except for insanity, then was released, had been living at the group home safely for 10 years. And then I guess it sounds like from what the staff had testified that he went off his meds and then that happened. How should the community in an ideal situation that you're describing handle a situation like this? How could this have been avoided?
Well, obviously, in a tragic situation like that, there are many different stakeholders. There's crime victims, there's workers who might feel afraid on the job. There's family members. There's the person who will spend the rest of his life in a psychiatric forensic unit because of this horrific crime that he or she committed. I didn't quite catch the gender of the person. I'm assuming it was a male for some reason. I think you need to get all of those stakeholders in a open dialogue together and discussing how to decrease violence in general, and not just people who happen to meet DSM criteria, but violence in general. People deserve safety. That's obvious, and it's tragic that occurred. But I just want people to remember that people who have been diagnosed with a mental health illness are more likely to be victims of a crime rather than perpetrators of a crime. So let's not be distracted by these tragic stories, and remember that when we make laws to rein in these examples of violence, that we are creating laws that will be subject to abuse, that will be applied to other nonviolent people who happen to meet DSM criteria, people like my daughter, who is nonviolent. And these laws will be unfairly condoning state-sanctioned violence against people like my daughter in order to prevent a few tragic situations like the one you described.
Your concern, it sounds like, is that this is a blanket policy and
absolutely
will apply negatively to people who are not in that same situation.
Absolutely.
Okay. Anything you want
clarifying?
Anything you would like to add that we have not covered?
Just the importance of peer involvement in the mental health, in the delivery of mental health services, and just the importance of a diversity of stakeholders being heard. I feel like the voices of people with lived experience of being harmed in the mental health system are not being heard in the formation of these laws.
Sarah, thank you so much for taking the time to do this interview. I appreciate it. Hope you have a good rest of your day.
You're welcome. Thank you.
Bye.